So, good morning. My name is Jasmine Lorico. I'm staff nurse from Learning Disability, HAMAD Medical Corporation. Today I will be reporting, I will be discussing about the importance of sleep in LD patients. So, our objective here is to identify first what is sleep, what is the positive and negative effect, what are the factors that affect sleep, and as well as our role as nurse, and what are the tools we are using in our unit to monitor sleep, and about the health education that we can provide for the patients. First, what is sleep? Yeah. It allows body to repair itself. It also helps our brain to recharge, consolidate memories, and process information. So sleep is really essential. So it's either for the normal patients or mostly for the special needs special needs patients. So what are the factors of affecting the sleep? So it's gender, age, if the presence of stress, the lifestyle, social factors as well, mental health condition, medical condition, and of course the medication. So let's discuss. Others are self-explanatory, but with the third one, the stress. So it affects our sleep. So especially for if you're been
Stress forward.
yeah, stress at work, or maybe some issues in family, so it affects you will not be able to sleep. Lifestyle, culturally, in the Middle East, they often sleep late, so that's already their lifestyle. Also during Ramadan, so they have changes. The day become night and the night become day. And other mental health condition, insomnia, and such. So medication, what medication do you think that affects the sleep?
Medication.
Fluoxetine.
Ah,
That's why we are giving fluoxetine in the morning. Yeah. So positive effects. So we all know, and we all experience that when we are getting enough sleep, we feel better, and it also boosts our immune system. It improves our mood and memory. So obviously, if someone who haven't slept well at night, he will maybe not be in a good mood the next day, especially with those who are working and even our patients. And also, of course, it improves health. It promotes healing. So the negative effects. So as we mentioned, they display negative moods, such as, can you give some example?
their irritability. They are very irritable. They don't want to talk sometimes.
Low mood, anxiety, frustration, and all. So it also leads to our problem with our patient, which is the challenging behavior. So what are the challenge? Can you cite some example of challenging behavior in adult with learning disability?
For example, they are experiencing a dental problem and they're experiencing pain, so they cannot sleep. They have disturbed sleep. So with that one, they will be having challenging behavior.
Exactly. So here, for psychological effect, of course, there is poor cognitive functioning and performances. We've been seeing this in our patient who's attending special needs center. So sometimes, I remember your patient, when she's sleeping during the
During the session.
during the session. So she was not able to do the task. Anyway, they are in consideration with their condition. Teachers are allowing them to sleep. So with the physical health, so it also affects us. It could lead also the consistent poor sleep pattern may lead to high blood pressure, increased risk of diabetes, because increase the chance of, increase the stress. So of course, high blood pressure can lead to stroke or any heart cardiovascular problems. So here in our unit, we are using tools to monitor the sleep. So first, the daily monitoring chart and the sleep diary. If the family or the caregiver will not be able to do it, to accomplish our chart, they can just write it down in the notebook, and then they can include in the sleep diary the how many what time the patient slept, if there is interruption, how many times they woke up, and if they will be able to go back to sleep. Also the quality of sleep, are they easily awakened, or and what time they woke up. So even the total hours of sleep. So we are also monitoring even daytime naps. So as example, you all know this one, these hours of sleep. Others are for the other monitorings as well. So we will be counting on this. We will see if how many hours of sleep the patient the patient has. Also the pattern is also important. The normal sleeping pattern of the patient, we should take note. We can add it in the sleep diary. And then, so what are the health education we can provide for the patient? Of course, sleep hygiene is very common. So with that, we can include this one, the establish the sleep-wake cycle. So we must know first their regular sleep-wake cycle. If they are really normally sleeping late but waking up late, then that is already their pattern, their cycle. We can also advise to do the warm bath before sleeping. Make the room conducive for sleep. If patient likes cold environment, then we can maybe open the AC or fan if they don't have the AC. Or if patient don't want the cold environment, then we'll do the otherwise. Avoid stimulants and fluids in excess. Stimulants such as coffee, soft drinks, and chocolates. Yeah. So fluids in excess because it may awaken the patient or the person to take to urinate in between. So we must limit, not give excess fluids before going to sleep, and then avoid using electronics or gadgets, which is very popular. Everyone has their own gadgets. Everyone has their own mobiles or tablets. Sometimes they will fall off to sleep using the gadgets, but others may lose this may not be able to feel sleepy, and they may become very excited with what they are watching or playing in their mobiles or electronics. So we advise at least 3 hours before going to sleep to avoid even watching TV. And then establish structured routine at daytime. This is very essential for our patients. So at least they will be exhausting all their energy during the daytime, and that will lead them to
Exercise.
they can do also exercise. Thank you. And then this one, so what we have discussed earlier, we are using this to educate our patients with mild learning disability because they understand better the pictures. So if the nurses or the key persons in the community, key workers in the community have their role, the family also has their role in establishing this treatment plan with the patient. So first, to be consistent. So to be able to develop a sleep habit, we should inform them that patients should sleep at the same time every day until they make it a habit. Make sure that the family also is following the structured activity. So we have to encourage them. If they are doing this and this works, we have to encourage them to continue doing it. So at least the patient can have this structured activity. And then if there is medication, to give on time and as prescribed. So sometimes in some cases, we need PRN medications for sleep, but we have to educate them not to give it in excess or just to give it according to the doctor's prescription. So that's it. Thank you so much. It's for references. You can check out that link. Any questions,
So,
reactions? Thank you so much for coming.